everybody, and welcome to the podcast, Coffee with the Kensington, where we talk about all things related to seniors, their caregivers, and families. My name is Brenda Moynihan, and I'm the host and the Director of Marketing and Outreach at the Kensington Assisted Living in White Plains. My guest today is Jennifer Lavelli, Medicare expert. Today we'll be talking about the topic, Demystifying Medicare, Parts A, B, and D. Before we begin, I'd like to give you some brief information about Jennifer. Jennifer Lavelli is a certified long-term care professional with additional certifications from America's Health Insurance Plans and holds life and health insurance licenses in New York, New Jersey, and Connecticut. A frequent presenter across Connecticut, New Jersey, and New York State, Jennifer teaches people how to access, apply for, and successfully use Medicare coverage. Welcome, Jennifer.
Thanks so much, Brenda. Thank you for having me. I do appreciate it.
So to kind of frame our little podcast, can you tell the listeners just briefly what the differences are between Medicare A, B, and D?
Of course. Thank you. So just to start off, I would just say to you that there really are 5 parts of Medicare, and they are A, B, C, D, and also Medicare supplements.
Okay.
But let me answer your question. Medicare Parts A and B are available from the government, specifically the Social Security Administration, and are referred to as Original Medicare. Part A is facility coverage. Anytime you're sleeping in a healthcare facility, hospital, skilled nursing, rehab, psychiatric facility, elsewise, you are billing to your Part A. Part B is all outpatient services. So most frequently used, going to the doctor, the lab, the radiology. Part B is being billed. Part D is not from the government. It is from a commercial insurance company. It is for your prescription drug coverage. So PDP, prescription drug plan, is a Part D insurance plan.
Okay, great. That was great. Okay. So now there are election periods, right, for Medicare A and B. Let's talk a little bit about that. The upcoming election period. When can people change? At what time? When? When can they make a change?
Everyone can change their mind about every part of Medicare they are already on during the annual election period that begins October 15th of every year and ends at midnight of December 7th of every year. They have that period of time to change their mind, and whatever options they decide to change to become effective January 1.
Okay.
Just as a note, there are many, many other election periods, but they're specific to individuals and or specific levels of coverage. So the annual election period is for everyone.
Okay, so during those 3 months, if I'm on A and B as in boy, and I decide I'd like to get D as in David, I can do it during those 3 months. Is that right?
Yes, you can get D every year between October 15th and December 7th,
Okay.
Correct.
But it's only during that 3-month period I can make those changes, correct?
With some exceptions.
Okay.
So again, there are special election periods for people. For example, those on Medicaid can change their mind all year long.
Okay.
Those who are in a facility can change their mind all year long. But everyone can use the annual election period.
Okay, good to know. Good. And what if somebody has Part D as in David, prescription plan? It's really not working. Do they have to wait until January 1st to make that change?
So as we've been saying, there are many different election periods for different people with different circumstances. So let me answer this way. For those who do have to wait for the annual election period, and this happens frequently, I get these calls maybe 2-3 times a week. They go something like this. My prescription drug prices are through the roof, or I just found out that I got a new prescription and my drug plan doesn't cover it. Those kind of issues pop up throughout the year for many people who cannot change their plan but that one time per year. And there are a variety of ways that we deal with that, notably 3 different attacks, if you will. One would be to try to work with your plan to get it covered, either by asking your doctor about an alternative medicine that the plan does cover, or by asking your doctor to file an appeal for a formulary exception with the plan. So in those ways, we can work with your plan, perhaps. If not, we try to reduce the costs of those meds until you can change your plan. So we look at, things as simple as GoodRx and InCareRx and AARP discounts, and perhaps even going to Canada. But we do deal with those a lot. That's the single most raised issue that I see in my practice with Medicare.
So wouldn't it behoove someone to, whatever medications they're currently on, to look to make sure their plan accepts it? Is that right?
Oh, before you choose, you would definitely want to do that. The issue arrives throughout the year when you get new meds, which is fairly typical, and that you can't control.
Right. Okay. And let's talk a little bit about, should someone choose the Medicare supplement or the Part C Medicare Advantage plan? What are the differences, Jennifer?
There are many, and that is the substance of my practice in consulting on Medicare, largely, which is people who don't know how to choose, don't know the coverage that each provide. So here's kind of the ground level difference. Medicare supplements are not health insurance. I'm going to say that again. They're not health insurance. They work with your health insurance, which is Medicare Parts A and B, and they pay the bills that Medicare sends to them. So they're really bill payers. They don't provide any health coverage on their own. So people who want to stay with Medicare Parts A and B, who do not really want to pay the out-of-pocket costs that Medicare entail, which include deductibles, co-pays, co-insurances, they say, well, let me get a Medicare supplement and have the supplement pay those expenses. So that's what a Medicare supplement is. And by its very nature, what you're choosing to do is to stay with Medicare. If you choose a Part C Medicare Advantage plan, you're choosing to work with a commercial insurance company, because that is the essence of a Part C plan, is that it's a commercial insurance coverage under Medicare. So the same insurers you've known all your working life, Aetna, Emblem, Empire, United Healthcare, they're all in the Medicare business. By choosing a Part C Medicare Advantage plan, you are suspending your governmental benefits from Medicare. You never have both at the same time. You don't have A and B and C. You have either A and B or C. So with a Part C Medicare Advantage plan, people appreciate that it's, generally speaking, lower cost and adds some bells and whistles that Medicare doesn't cover, notably dental, vision, and hearing.
And it also includes what would have been the A and B?
Correct. Yeah, and D. So it covers health, hospital, and drugs in one piece.
And let's go back to the Medicare supplement. How can you be sure that whatever you're paying for the supplement is less than if you only had the A and B with the deductibles and out-of-pocket expenses? Do you know what I mean?
Yes, it's really easy because it comes about in the monthly premiums. So if you have, and here's how I explain it to people. With Parts A and B alone, I call that affectionately naked Medicare. If you have A and B alone, yes, you have 20% here and there, you have deductibles, but if you're a relatively healthy person, they are de minimis. They're really not going to break the bank. The flaw with Medicare Parts A and B is that there is no limit to your out-of-pocket cost. No one's counting. There's no limit. So if you became very ill or started consuming a lot of healthcare services, you don't know what you could possibly have to pay.
Mhm.
That's the flaw. And that's what I focus people on in my practice, which is to say, that's what you're trying to solve for with a Medicare supplement. You want to make sure that you know what your maximum out of pocket is. So the difference in your costs may not be visible on a day-to-day basis. What you're looking at is planning for the unforeseen event
Mhm.
and keeping yourself safe, financially speaking, from what could be devastating expenses from Medicare. But other than that, I would say that people believe that the more you pay, the better it is, and I debunk that myth multiple times daily,
Mhm.
because you don't have to buy the most robust, expensive Medicare supplement if your expenses are relatively low. You can cover that flaw, that risk of no out of pocket, for as low as $69 a month.
Wow. And the supplement, those premiums increase every year?
Pretty much. Yes.
Mm.
Last year, New York State did not allow an increase, but now the insurers, I just got notice from one of the biggest ones that their premiums are going up September 1.
Okay. And are we talking substantial?
In this case, it's up to 5%, which is kind of high. It's been between 1 and 3 traditionally. So I think they took into account they didn't get approval last year, and they just
Right,
came
and they
down.
just,
Yeah.
right. So, is there any one tip, and I know I'm putting you on the spot, any one tip that our listeners should know, maybe those that are just going on to Medicare, those that are currently on Medicare, any one nugget that you can tell our listeners?
I know this sounds self-serving, but I always tell folks, whether it's me or someone like me, it's really well worth it to work with a professional who can show you all your options and spend the time necessary to review those with you, even creating hypotheses about what your future healthcare needs may be, looking at it through the lens of your prior year's history of healthcare, so that you can understand that there are a variety of options, that they will cost different amounts, and feel confident that you've made an informed decision. Sure, you can change it every year, but you've got to live with it for a year.
Right.
So make an informed decision is my advice.
And Jennifer, tell our listeners if they'd like to get in contact with you, how can they do that?
Well, you can go to my website, jenniferlavelli.com, and there's lots of information if you're just thinking about your transition, your future transition to Medicare. There's videos and information there. There are also some forms you can fill out if you'd like to engage my consultation on a variety of issues. You can call me at 914-295-4502 or write me at jenniferlavelli@live.com.
And one more thing I want to tell our listeners, to learn more about Medicare A, B, and D, Jennifer has written a wonderful article. It's on our website. Please feel free to go to the Kensington's website at www.thekensingtonwhiteplains.com. And if you'd like some more information about the Kensington, again, please go to our website, www.thekensingtonwhiteplains.com, or feel free to call us at 914-390-0080. Thanks, Jennifer, and have a great day, everybody.
Thanks, everyone.